Okay, my name is Mark Ma. I'm the physician scientist from UCLA. Today I want to share some thought on the neuromodulation. Neuromodulation is approach using currently there's three traditional ways to modulate the neural system, targeting on the specific region of your brain to help the patient to improve the disease conditions or help them to do something they cannot do because of the disease. The three ways to modulate the neural brain function are the electronic, magnetic, and the chemicals. The first one is quite invasive. Like I think the famous one is Aaron's MCI, the brain computer interface, and they implement a chips in your brain to send a signal to brain to help you to move around or to see something, to help patient to do something they could not do due to the diseases. The second one is magnetic. Normally is a transcranial, is non-invasive, and still same thing, target on certain area of the brain to help your brain move and send a signal to the bodies across the different part of your body, right? So that's the neuromodulation. Third one, of course, chemicals. Depends on the disease. They can use a different drug, chemical medicines to treat the diseases. For instance, like for the ADHD, the attention deficit and the superactivity disorder, which often happen to the kid, to the adult, and so on and so forth. I think in that case, the patient cannot focus on something. They always jump around. But nevertheless, the chemicals is a stimulant. Stimulant give you the additional energy per se to the brain to help them to more focus, to function better, to improve the cognitive performance, right? That's a traditional way to treat the different diseases through the neuromodulation. However, the recent year, the new technology pop out. It's a phototherapy. It's a transcranial neuromodulation approaches, which is the light therapy. There's a continuous light. Depends on the wavelengths of the light. Either way, it's 810 or the 10864 different nanometers light. They can target on similar neural or brain areas and stimulate the brain to make them function better. From the approaches, if you really compare the approaches, if you really compare the three different approaches, I think my way or my will is focusing on the efficacy, safety, and the convenience. Right? If the device can be used in the more convenient way for the patients. The first one, of course, from the efficacy point of view, if you use electronic stimuli like the chips in the brain, definitely send the signal to the brain. It works a little bit strong and effective. From the safety consideration, it's a little bit aggressive, or there's a concern for sure. The second one is the magnetic. Magnetic is transcranial, is non-invasive. However, people do have a question on whether this can be more specific, target on certain areas precisely, and achieve the effect people are looking for. The chemicals, so far, especially for the ADHD, the stimulant or the standard of care and the behavior training, so on and so forth. However, using the stimulate, people always worry about the drug abuse, especially for the kid. You give the stimulant, eventually going to be a lifelong concern, right? So that's why the number for the newcomer need more attention, because the light therapy is transcranial light therapy is non-invasive. Because the light can target on a certain area of your brain more precisely. In that regards, can you achieve the similar effect, but it's with a more or better, way better safety profiles. And of course, depends on the design of the device. It can be wearable. You can use in the clinical side. The treatment can be done by the doctor and the physicians as well. There's two main players in the phototherapy area, Light and Brain Loom, and they both offer a device can serve the purpose, transcranial phototherapy. And but if you're looking there, the convenience from that regards, definitely you can see Brain Loom offer a wearable devices you can take home. You can do that every 20 minutes per day for the treatment, and you can see the improvement in your focus, in your attention, especially for the potentially for the ADHD patients. Light doing the similar things. Their design a little bit different. It's a whole scale device, and but the essential ideas definitely is to achieve the neuromodulation and stimulate certain brain area to help the patients to improve their cognitive performance and make their life better, actually reduce their anxiety and help their sleep and help them pay attention on the certain things they can do. Right, so I just want to share this kind of new technologies, phototherapy, and we're closely watching this technology. I do believe there's some bright future if people further develop these technologies.